Okay, so my examiner has told me that my scene safety has already been done. So what I'm going to do is I'm going to ensure that I close the door or pull the curtain for my patient's privacy and dignity. So before approaching my patient, I'm going to do my hand hygiene. Following steps for World Health Organization, steps for hand hygiene. Palm to palm, back of the hands, fingers interlaced, fingers interlocked, rotational cleaning of thumb, fingertips, and let it air dry for 30 seconds. Hello Sean, my name's Rebecca. I'm one of the nurses here today in the clinic, going to be looking after you today. So how are you feeling today? Are you okay?
It's okay.
Okay, so before we start, Sean, I'm just going to start by checking your ID, if that's okay. Could you tell me your full name, please? And I'll counter check it with my documentation and your wristband.
Sean Dillon,
Yeah, and your date of birth, please?
5/6/1980.
Lovely. And do you have any allergies at all, Sean?
No allergies as far as I know.
Okay, that's brilliant. So I'm happy that that matches my documentation and your wristband is correct also. So I'm happy that I've got the correct patient. The reason for today's appointment is basically I'm going to be doing a peak expiratory flow test with yourself today, and that's to test your lung capacity, and that is all part of your respiratory assessment. So what that involves is we're going to be doing a few different readings today depending on the results. Do I get your consent to proceed?
Yes.
Okay, brilliant. So I'm just going to prepare my equipment and put on my PPE. Is that okay?
Yes.
Brilliant, thank you. So before I prepare my equipment, I'm going to do my hand hygiene. I'm going to wear my apron. Examiner, can I just ask, is my tray disposable or reusable?
Disposable.
Thank you. So I'm happy that this tray is nice and clean, dry and intact, and I'm happy to use that. So I have here a disposable mouthpiece that's dry and intact, and I'm happy to use that. Next I have here my peak expiratory flow meter. So examiner, can I just ask, is this meter less than 12 months old?
Yeah, it's just 6 months old.
Okay, brilliant. And has it been cleaned in the last 24 hours?
Yes.
Okay, thank you. I'm happy to use that. Okay, Sean, I'm back. I've got my equipment. I'm happy that you're in an upright position. Are you comfortable there at the moment?
Yes.
Okay, brilliant. So I'm going to start by explaining the procedure to you, Sean. Okay. So what we are going to use today is this is our peak expiratory flow meter, and this is a disposable mouthpiece that we're going to use today. So I'm going to place the mouthpiece in the end of the flow meter, and what I'm going to do is I'm going to ask you to hold the peak expiratory flow meter between your fingers like this, making sure that you don't impede the gauge. So we have a gauge here in the middle, and we have a needle which is at 0 at the moment. So when you blow through the meter, I don't want your fingers to impede the gauge because that might alter our reading, okay? So I want you to hold it horizontally like this, and what you're going to do is you are going to inhale completely, and then you're going to immediately place the mouthpiece in your mouth, creating a tight seal with teeth and lips around the mouthpiece, and then you are going to exhale as forcefully as you can with a short, sharp huff. Okay?
Yes.
Do you understand the process?
Yes.
Okay, brilliant. Okay, so Sean, we're going to do our first reading. Examiner, can you just ensure that my needle is back down to 0 before we begin? Okay, so Sean, you're going to hold this in your mouth horizontally. You're going to inhale completely, and now immediately make a tight seal around the mouthpiece with your lips and your teeth, and I want you to exhale as forcefully as you can with a short, sharp huff. Short, sharp huff. Examiner, what's my first reading, please?
610.
Okay, examiner, can you confirm that that's 610 litres per minute, please?
610. Yes.
Thank you. Okay, so Sean, your first reading, your result was 610 litres per minute. I'm going to ensure that the needle is back down to 0. Examiner, can you confirm that's back down to 0, please?
Yes.
Okay, brilliant. So how are you feeling, Sean? Are you okay?
Yes.
Brilliant. So we're going to repeat the process again, okay? So you're going to take a nice deep breath in for me, please. create a tight seal around the mouthpiece, and exhale as forcefully as you can, short, sharp huff. Examiner, what's my second reading, please?
590.
590. Examiner, can you confirm that's 590 litres per minute, please?
590.
Brilliant. Okay, Sean, so your second result was 590, so I'm going to ensure that the needle is back down to 0. Examiner, can you ensure that that is back down to 0, please?
0. Yeah.
Okay, well done, Sean. You're doing a great job. How do you feel? Are you okay?
Yeah.
Brilliant. So we're going to repeat the process again, one last time, okay? So if you inhale completely and immediately place the mouthpiece into your mouth, creating a tight seal, short, sharp huff as forcefully as you can. Examiner, what's my third reading, please?
600.
600.
Yes.
Okay, Examiner, can you confirm that's 600 litres per minute, please?
Yeah.
Brilliant. Okay, so Sean, your last and final reading is 600 litres per minute. So I'm happy that those 3 readings are great because we've got no difference of 40 litres between consecutive readings, and also I had no consecutive readings that were the same there. So I'm happy with those readings, okay?
Yes.
So just to summarise, your first reading was 590 litres per minute. The second reading was 610 litres per minute, and the third reading was 600 litres per minute. So I'm happy with those results. I'm happy that we had no consecutive readings and that there was no difference of 40 litres between each reading. So I'm happy to proceed with those readings, and they are going to be reliable for my documentation. So what I'm going to do now is I'm going to dispose of my equipment, dispose of this disposable mouthpiece, and I'm going to ensure that I clean out the peak expiratory flow meter with hot soapy water in between uses. My tray is disposable, so that is going to go into the bin. And I'm going to remove my PPE and do my documentation. So if you need me in the meantime, Sean, please just give me a shout. I'm just going to be doing my documentation, okay?
Yes.
So make sure that I do my hand hygiene. Okay, so that's my documentation done. So I'm now just looking at my peak expiratory flow rate for the normal values for a male aged 43 and of 175 centimetres. So the normal value should be 630 litres per minute for a healthy male adult. And our highest reading today is 610 litres per minute. So it's slightly under. So I'm finished my documentation. I'm going to do my hand hygiene again. Okay, Sean, so I'm back now. So I've done documentation, and from today's respiratory assessment, your highest reading was 610 litres per minute. And I've looked at the chart for an average male the same age as you and for your height, and the result for a healthy male should be around 630 litres per minute. So with your result being 610, that is slightly under, but that's to be expected because you've had a probable diagnosis of asthma. Okay, so what I'm going to do is I'm going to escalate that to your doctor, and that may go towards any medication changes for yourself. Okay, are you happy with today's assessment? Do you have any questions?
No, I'm okay.
Okay, brilliant. So thank you for your time. Like I said, I will hand this all over to the medical team and to your doctor, and I'm sure the doctor will be in touch with you soon. Okay. Examiner, I'm going to finish my station with hand hygiene.